Hello, everybody. My name is Rachel Smith. I currently attend Howard University, and today I am discussing the effects of anemia and iron deficiency in women. This is for our nutrition class, and let's jump straight into it. So, the abstract. Millions of people throughout the world suffer from iron deficiency anemia. This disease affects far more women than males, and it has a negative consequence for everyone who suffers from the deficiency. This reduces oxygen carrying abilities, and although the reasons differ between populations, the symptoms are consistent. Much of the study into iron deficiency anemia focuses on not only the therapy, but also the prevention of the disease. To gain a better grasp of how to address this issue, one must first understand what is iron deficiency anemia, what causes it, and how it affects people, and lastly, how to cure it. These all play a huge factor in preventing iron deficiency anemia. So today we will be discussing the introduction, the research question, the purpose, the discussion, and lastly, we'll jump into the conclusion. Introduction. So, anemia. Anemia is a prevalent global public health concern that affects both developing and underdeveloping countries. So, with serious implications for human health and social economic development, it affects people at all phases of their lives. But it is more common among pregnant women and young children in both developed and developing countries. So, what is iron? Iron is a mineral that contains a hemoglobin. The, the red blood cells, hemoglobin, it aids the distribution of oxygen throughout the body. Oxygen cannot be carried to its full capacity without this mineral. Iron deficiency affects 1 out of every 10 mothers and small children. Iron deficiency causes fatigue and is comprised and it compromises immune systems. Children who do not get enough iron are more likely to have problems with their intellectual development, and an iron deficiency, on the other hand, does not always imply an anemia, but most people with anemia have an iron deficiency. Only 3.3 million women are anemic, but 7.8 million are iron deficient. Iron deficiency anemia was regarded as one of the most significant contributors to the global burden of disease in 2002. Anemia is caused by a wide range of factors that can be isolated, but more frequently than not coexist. Iron deficiency is the leading cause of anemia worldwide, hence the terms IDA. And anemia are frequently interchangeable, and the prevalence of anemia is frequently used as a proxy for IDA. So, iron deficiency is thought to be the cause of half of all cases of anemia, but the proportion varies among demographic groups and in different places depending on local factors. Low iron consumption, poor iron absorption from heavy diets can also play a huge role. And during a stage of life when iron requirements are very high, the main risk factors for IDA play a huge role. The most common cause of anemia is iron deficiency. Anemia causes blood to clot. For both men and women, blood loss from the gastro tract is a major cause of anemia. A gastrointestinal problem develops when blood is found in stools. Many times, people are completely oblivious of this problem, that their waste products are containing. When kids start to have anemia symptoms, they have blood tests that show that they are anemic. This process is uncovering further health concerns, and it's best to address the issue before it develops into something worse. Anemia is a risk factor for a number of diseases. Many times it is just a symptom of serious illness, such as peptic ulcer disease, gastric hemorrhoids, and colon cancer. During a woman's monthly period, she may experience heavy blood loss as a result of menstruation, as well as parasite infection known as a hookworm or many other things. Among this reason, it can cause anemia. Acute and chronic infections such as malaria, HIV, tuberculosis, and cancers can drop HB levels in the blood. Other micronutrient deficiencies, such as vitamin A and B12, also can be avoided, which would negatively affect your iron levels. Anemia is a sign of a poor diet or a sign of poor nutrition, as well as bad health. And most serious health consequences of anemia, namely a higher risk of maternal and child death as a result of severe anemia. So, who advocates a multidisciplinary strategy customizing unique circumstance to combat iron deficiency and anemia? So, one of the ways to combat anemia would include increase your iron intake. Many people in public health believe that your food plays a large role on the iron that you intake and it overall affects your health. The UNRWA launched an iron deficiency anemia prevention and treatment program in line with this policy, consisting of pharmaceutical iron supplements, of wheat flour provided to target communities receiving regular and emergency food assistance from the agency, and increased use of contemporary contraceptive methods. So, a large question, which is the research question or hypothesis, is anemia should not be considered a natural part of the aging process. In many people, the increased deficiency is normalized as people get older. Does anemia and iron deficiency increase in women as they age? This was a major question that I had. So let's jump into it. The purpose of it all. The purpose of the research is to identify the realistic cause of iron deficiency and the effect it has on people. Iron deficiency anemia is rather frequent among the elderly. According to a 2008 research, 12 to 47% of older people will acquire some kind of anemia depending on the community in question. According to the study, anemia is most common in older people, affecting roughly 17% of the population over the age of 65. Iron deficiency anemia, in particular, is thought to account for around 1/3 of anemia cases for older persons. According to research, despite the fact that some of the iron deficiency anemia cases are mild, anemia in older people lead to a variety of negative consequences, including extended hospital admissions and even death. As a result, even minor cases of anemia will be diagnosed and treated by doctors. There are many reasons that can trigger people's iron deficiency levels. For example, if the body does not obtain enough iron to rebuild healthy red blood cells, low dietary iron consumption may produce symptoms. Anemia may be more common in those who follow certain diets, such as vegetarians, other than those who have a more common diet. Those who can constantly consume iron-rich foods may not have this problem. Anemia can develop if a person loses enough healthy red blood cells as a result of bleeding. As the skin ages in time, as the skin ages and thins, external bleeding is more frequent, making cuts and scratches more likely and more damaging. It is also possible that these wounds and scrapes will take longer to heal. Internal bleeding, such as ulcers and stomach or intestine problems, can lower the quality of healthy red blood cells in the body, resulting in iron deficiency anemia. Internal bleeding can often occur as a result of trauma or injury, resulting in blood loss. Internal bleeding is a concern with some drug or combinations of medicine, especially when used for a long term. People in medical care who regularly require testing may be subjected to high numbers of blood drawn, and this could overall lead to a problem. So let's jump into the discussion. The overlying discussion. The overlying discussion is how to attempt to make more people aware of the consequences of iron deficiency, while including ways for humans to build up their iron, and depending on the underlying cause and degree of anemia, doctors may offer several different treatment offerings. Because various causes may be contributing to the disease, treatment will differ from case to case. To rise the person's iron level, a doctor may prescribe supplemental iron in the form of medication, dietary iron, and other forms of iron. If anemia is caused by an underlying element, the doctor will seek treatment for it. This may help them uncover other underlying causes of anemia or resolve the anemia straight on. Iron deficiency is a leading cause of anemia, like I said before, which affects 1 in 4 of the world's population. Chronic weariness, poor cognitive function, and low sense of well-being are all symptoms of anemia. Patients with iron deficiency anemia of unclear or typically referred to gastrological because the illness of a gastrological origin in the majority of cases plays a large role to iron deficiency. Proper management includes improvement quality of life, it minimizes the need for blood transfusions, and alleviates the symptoms of iron deficiency. So, oral and intravenous iron therapy are two choices for treatment. However, oral iron deficiency is limited in the gastrointestinal disease like inflammatory bowel disease, celiac disease, and autoimmune gastritis. If a doctor feels a prescription or combination of medicine is causing anemia, they may suggest alternate treatment if they are available. Alternatively, they may offer alternative methods of managing anemia until the person is able to stop using the medicine. Conclusion. In conclusion, iron deficiency anemia is frequent in elderly people, and it can be caused by a variety of reasons. Blood loss, nutritional deficiencies, medicine, underlying disease, and malabsorption are all possible causes of iron deficiency anemia in this age range. Individuals who are having iron deficiency anemia symptoms should consult a doctor for a diagnosis. The doctor should be able to advise you on how to boost your dietary iron intake or address any underlying issues that are preventing you from absorbing iron. Anemia and iron deficiency. Anemia and iron deficiency in women affects me in a multitude of ways. Growing up in a larger family of 7 and being an African American woman, a previous family history of iron deficiency and a lack of vitamin D, I personally find it very important to pay close attention to the different needs my body is telling me. I noticed while participating once in a blood drive that some of my peers and the women around me were not able to donate due to a lack of iron in their blood. At the time, I was not aware of the causes of this low iron and this overall iron deficiency. But as I grow older and educate myself on the different realities of people's life, it has become more clear to me that iron deficiency is all around us. And it's important to address this head on because at the end of the day, we want our women, our men, our humans to be safe regardless of race, demographic, location, sex, or gender. The best way to avoid iron deficiency is consuming foods high in vitamin C and vitamin B9. And B12 will also help improve iron absorption. Limiting the intake of food that may block iron absorption, such as dairy or food high in acid, will allow you to absorb more iron-rich foods, such as dark leafy greens, animal products, and other foods along that line. Also, beans. Also, taking iron supplements or foods can help alleviate the burning sensation in the stomach that someone might feel. To reiterate all that I mentioned before, iron deficiency is all around us. It's important how we address the situation, and it's even more important to be aware of how it affects us and to not be scared to speak to an advisor on how to better our health. I wanted to share the different references that I have, and I want to thank you all for listening to my presentation about iron deficiency and the effects of anemia in women. Thank you, thank you, thank you. Credits to the professor and the lovely class. Thank you all and goodbye.